Hi, my name is Dylan Eckmeyer, and I'm part of Student Group 3. The other members of the group are Michaela Olson, Lori Abbott, and Stephanie Schaller. For this section of the presentation, we will be going over the review of previous or similar studies/cases to better understand our case. Our group chose an article that discusses the fatal ingestion of Taxus botica. The victim was poisoned due to the consumption of the alternative medicine. During the autopsy, the leaves of the Taxus botica were found in the victim's stomach, and the cause of death was due to alkaloids from the plant that were found in the victim's blood. The first similar case that we found was due to the poisoning and ingestion of oleander leaves. Oleanders are an evergreen shrub tree, and they contain leaves, flowers, fruits, branches, and its stem. In this case, a 58-year-old female was found in a truck stop in her car, grasping onto the oleander branch. Her husband and daughter's statements stated that the woman did not suffer from depression or other diseases, and that she was not on any prescription drugs. In the article, it is said that the woman was wanting to commit suicide. The autopsy found oleander leaf on the posterior third of the tongue. The stomach walls were intact, but the gastric contents contained brownish fluid and plant residue. She had multiple organ congestion, and pulmonary edema was observed. As you can see from the pictures, there is a plant leaf, an oleander leaf, that was taken from her stomach. The next case that we found was a fatal ingestion of colocine containing leaves. So in this case, a 65-year-old woman was collecting plant leaves, and she took about 100 grams of that, boiled them in water, and mixed it with honey. She then consumed the mixture. After a few hours had passed, she started to feel sick. She had some stomach aches and had diarrhea. She was admitted to the hospital. They ran some tests on her, and she ended up falling into a coma, and the next day she ended up passing away due to multiple organ failure. The plant that she collected was the autumn crocus, which can be confused with bear's garlic, which is used as an herb when cooking. Confusion may have took place because in spring and late autumn, only the leaves are seen on the plant, no flowers or anything else. The post-mortem examination showed that she had some pre-existing diseases, and her stomach contents contained about 70 milliliters of a black mushy liquid, but no plant matter was found inside her stomach. Also, there were signs of multi-organ failure. The toxicology findings found that colocine, or a lipid-soluble drug that can penetrate the body tissue, was found in her system. Colchicine is an anti-inflammatory that can treat and prevent gout attacks, but also treats Mediterranean fever. Colchicine works by decreasing swelling and lessening the buildup of uric acid crystals that cause pain in the affected joints. Our last slide is our reference slides, and it just has the journal that we chose for our group, along with the two other journals that we found similar to our case. I hope you enjoyed the presentation, and thank you very much.